Hi, it's Dr. Noel Williams, August 11, 2021, Optimal Health Associates, Oklahoma City, Oklahoma, COVID update. So I had already done one today, but we're not using that one because I had some requests from chief medical officers to change or add some things. So let's talk about first something that I've discussed many times, and I've said this, but it's clear there's some misunderstanding. When we're talking, whether you agree or disagree, if you're a scientist, physician, provider, so you believe everything the FDA says, which is fine. When we're talking about what my central criticism of the FDA, CDC, NIH, and all umbrella medical organizations have been is not to codify an outpatient therapy for people with early COVID. And so, again, in discussing this, I'm not saying you have to do this or anything, but I'm just going to go over it. Outpatient therapy is to prevent hospitalization. So whether it was hydroxychloroquine or ivermectin, its role is for outpatient therapy. So if you're getting admitted to the hospital and you have to be really, really sick to be admitted to the hospital, and you're going to be past day 7 or 8 to get admitted to the hospital, that window for those therapies has essentially passed. I mean, they might have a minor effect at best, but the window has passed. And so what is happening in Oklahoma City today was a couple families had to get escorted out, unfortunately, of hospitals because they were so upset that they were not going to be provided their loved one ivermectin or hydroxychloroquine. And again, when you have very scared family members with very stressed out providers, sometimes communication can break down, but the hostility level can get a little bit out of control for the loved ones. And again, I'm not judging that. It's unfortunate and not helpful for the care of their family members or for the providers who are already, as I've mentioned, kind of tired and worn out and have questions in their own minds about why they're even seeing these people who are sick at times. And again, I'm not judging that either. I'm just describing it. So it's important to understand that if you go to the hospital and you're really sick with COVID, or you're taking someone, you're going to get IV antibiotics and you're going to get IV steroids, which is the two essential things you need, plus supportive care. So you're not getting shorted on anything if you don't get the hydroxychloroquine or the ivermectin if you're in the hospital, because it's too late. The purpose of those is to give those in the first week to lower the hospitalization rate, which, depending if you believe the studies or not, again, because I have to be very politically correct so this doesn't get pulled, it's about a 95% reduction in some studies. But once you're at the hospital, they're not there, and getting mad about it and yelling at everyone isn't going to help you or your loved ones. So everyone who's seen this post, please forward it to as many people as you can. I'll try to make it a little shorter. But that is a key idea, because we need to have people stay calm and have people understand that the roles for some of the things that we've talked about over the last 18 months disappear as you get super ill. So how do we prevent this from occurring? Well, if you haven't been infected with COVID with documented antibodies, or you haven't been vaccinated, you are not going to be immune to COVID, most likely. If you're in those other two groups, you most likely are going to be pretty immune to COVID, because that's what the data shows. Okay, that's the data. Some people can argue certain parts of it, but essentially it looks like you have about a 99% reduction in severe disease, as long as you weren't on chemotherapies or immunosuppressants when you got sick or when you got your vaccine and aren't still currently on them, because they're immunosuppressants. So let's just go with that as a concept. But if you haven't been infected and if you haven't been infected and have documented antibodies, or you haven't been vaccinated, you can get COVID. And so the number one way to prevent getting COVID is to be vaccinated. And I'm not saying, again, I'm not arguing with anyone over the fact that you may have a reason not to get vaccinated because you had, let's say you had a prior severe reaction to a vaccine or something. But the reality is, your number one way of preventing a serious COVID illness and saving your life or saving you from serious morbidities and long-term effects of COVID is to have gotten vaccinated, if it's even vaguely reasonable for you. I don't know what else to tell you about that other than it's the truth. And, you know, why do you think someone like me got the vaccine, and why did Kim get the vaccine? Because we looked at the data. I understand this reasonably well, and I felt the vaccine was safe. And I looked at the risk-benefit ratio for me as a 57-year-old, but at the time 56-year-old male with not really much health problems at all, and somebody who takes all the supplements and does all this stuff. But I recognized I had still a 15 to 20% chance of getting significantly ill with COVID, and a 10% chance of being hospitalized, and a 2% risk of death. And so for me, that said, I don't want to have that because I couldn't control it, and I like to be in control of stuff. And remember, I have access to ivermectin and Plaquenil for myself, but the vaccine trumped the need for it and brought it under control. So that was a personal choice for me, and it's what I've encouraged people to think about and do for themselves. And I respect those that don't want to do it, and we of course will help everyone in our practice who gets COVID, whether they're been infected before and get reinfected, which we've had a grand total of 2 of in 18 months, and one of them has an immune defect, so that doesn't really count. If you've been vaccinated and you get it, we're going to treat you, or we're going to help you. I don't want to use treat because I don't want to get banned. And third, if you're unvaccinated, we're going to treat you, or excuse me, help you as best we can, unless you have to go to the hospital. But once you go to the hospital, they do different things. It's not outpatient treatment strategies. Yes, giving some vitamin C IV is probably helpful, and there's some other things, but ultimately it's IV steroids, oxygenation, and IV antibiotics, and supportive care. So that's what you have to think about. Be nice though when you're scared. If you're there with a family member, and I'm, as a surgeon and someone who's had a wealth of clinical experience now, 32 years in being a doctor and being incredibly busy, people get stressed. And one of my favorite things to say when someone looks at me at the beginning or in a morning of surgery and they're all tense, one of the family members, and they look at me and because they're so nervous, and I understand it. And they go, "Are you going to do a good job today?" I always usually say, for the last 15 or 20 years, go, "Well, is it an even or an odd day?" And they always look at me, and then I always say, "Hey, I know you're scared. I know you love this person. I'm going to treat her the way she needs to be treated. Don't worry." And a lot of times people who are angry start crying because they just needed that release. But it's hard for everyone to take that breath in when you feel that hostility, and you have to age and understand it. So people need to be nice to the providers. The providers, like God willing, will be nice to you. But you have to understand, the people who are in the hospital from our COVID task force meeting last night, it's running between 90 and 100% facility to facility, roughly, with the people being, unfortunately, either couldn't get vaccinated or chose not to get vaccinated. And then, it's virtually 100% in the ICUs. So it just makes everything so unpleasant and complicated. So let's just go over some final thoughts. The CDC and, the NIH data from Fauci's own division shows that people who have been vaccinated or been infected with a documented infection have long-term T-cell immunity. So you could be vaccinated and immune,
or infected
and immune.
There's plenty of articles
Now, the journal Science, multiple others showing the same thing with B cells.
that is going to run
In both groups,
about a 95
plus % partial to full immunity from COVID.
with essentially we're looking at about a 99% or 98% reduction in serious disease is what we're estimating. But again, we'll follow that.
We'll see. France totally recognizes it, and their plan takes into that. So it's not just me saying it; it is an entire country. So, but that's okay.
But over here, but some of those people
Can still get sick,
and 1% of them
are
are
going to get really sick.
over here. We have the unvaccinated,
And uninfected
so they're don't necessarily.
rarely have the right tools already pre-programmed in their immune system.
Now, are some of them going
They
to
have cross immunity because of potentially their MMR vaccine, their DTaP vaccine, their
prior corona cold?
cold viruses. Yes, they will. But one, we don't know who you are.
And obviously, since people
People are still getting really sick from COVID. It's not enough that you want to make that your final choice if you're an adult.
so just try to remember this. Spread the word. Send this
To as many people as you can.
and because be nice matters, calmness matters. We need to help everyone around us get through this.
It's going to be,
Another 4 to 8 weeks most likely. And we just
have to spread the word to stay calm.
understand when interventions matter and also realize
There's things hospitals can't do because they don't work or they're not allowed to do them. And yelling at them doesn't help, and no one needs to get arrested or have problems. And
the staff's already worn out.
just like the family.
So anyway,
Enough of that. God bless. I did something fun today this afternoon, which I recommend to everyone. I took Gideon, my soon-to-be freshman,
down to Fort Sill.
to go to the military museum there of artillery. It's very interesting. It's
Perhaps I think it's
better even than the 45th Infantry Museum
here in Oklahoma City. So if you have any military history buffs out
out there. It's a wonderful little museum
down there,
We spent about an hour and a half, 2 hours, and then had lunch in Lawton, which was fun, late lunch.
so anyway,
Just take advantage of things you can do in Oklahoma. And good night. And all providers out there, hang in there. Doctors, nurses, respiratory therapists, staffs at these hospitals, first responders, EMTs,
and then all the families.
of everyone. God, please,
You're in my prayers for your family members who are sick, and let's all try to stick together. Good night.